Today's lecture is about injuries to the urinary system, which are one of common diseases in the urinary system. Among the injuries to urinary system injury, ureteral injury is the most common, followed by renal and bladder injury, and ureter injury is relatively rare. The injuries to the urinary system are often complicated by organ injuries when chest, abdomen, vest, and pelvis are under severe violent impact, forming crush and penetrating injuries. First, let's learn about the renal injury. The kidney is a relatively concealed retroperitoneal organ and not susceptible to injury, which is often caused by violent impact on other parts of the body. The renal injury can be divided into blunt injury, penetrating injury, and laterogenic injury by mechanism. Traffic accident, falling accidents, and direct impact are the main causes of blunt injury. Penetrating injury is often caused by sharp objects, bullets, or sharp nail, resulting in obvious injuries to renal parenchyma and blood vessels. The laterogenic injury mainly includes the renal injury caused by percutaneous renal puncture. Intracavitary urological examination and treatment. According to the pathologic changes caused by renal injury, it also can be divided into mild and severe injury. Mild injury includes superficial laceration of the renal parenchyma, small subcapsular hematoma, and renal contusion. Severe injury includes deep laceration of renal parenchyma, renal vascular pedicle injury, and renal fracture. What are the clinical manifestations of renal injury? The most common manifestation is shock, mostly caused by bleeding and trauma following severe renal injury, especially renal pedicle injury or other organ injury complicated by vascular injury. Hematuria mostly gross hematuria and occasionally microscopic hematuria is also a common manifestation varying with the severity of renal injury. Another major manifestation is local pain, often occurring on the upper abdomen or bilateral renal region. In addition, there are also other clinical manifestations such as abdominal mass and fever. For the diagnosis of renal injury, it is often necessary to determine whether there is a renal injury, judge the severity of the injury, understand the situation of the contralateral kidney, identify whether is associated injury or systematic injury. At the same time, the conditions of abdomen, back, lower chest, and other parts need to be checked for the possibility of renal injury. The main examinations for renal injury included routine B ultrasound examination, intravenous pyelography, CT, and arteriography. At present, there are main treatments for renal injury including emergency treatment, conservative treatment, and surgical treatment, and treatment for the complications of renal injury. The emergency treatment consists of rapid anti-shock therapy, further detailed examination, and determination of other organ injury. In terms of conservative treatment, the patients must rest in bed for 2 to 4 weeks, receives monitoring on physical index, especially hematuria, take preventive antibiotic and drugs for hemostasis. sedation and analgesia as adjuvant treatment. The surgical treatment applies for severe renal injury which requires operative repair or renal excision. The surgery is often performed through an abdominal incision. As for complications, the early complications include retroperitoneal urinoma, residual hematoma, complicated infection, and perinephric abscess, while the long-term complications are renal atrophy, fatty change, and pyelonephritis. Next, we will learn about the ureteral injury. Due to the small diameter and location in the retroperitoneal space, ureter is protected by muscle and retroperitoneal fat with a certain activity space, making it less susceptible to injury. Ureter injuries are mostly penetrating abdominal injury or laterogenic injury. The main causes include traumatic injury, surgical injury, intraluminal instrument injury, and radioactive injury. Traumatic injury is mainly caused by gunshot or knife cutting, often directly resulting in ureter perforation, fracture, or cut. A surgical injury often occurs in the lower abdomen or pelvic surgery, such as hysterectomy, radical resection of rectal cancer, and large ovarian tumor resection. Instrumental injuries refer to the laceration or tear of urethra following ureteroscope examination, ureterocele dilation, laterotrapsy, stone collection, and laser treatment. Radioactive injuries include ureteral injuries caused by the need for high-intensity radioactive treatment for various pelvic tumors. The clinical manifestations of ureteral injury depend on the time of occurrence, whether it is unilateral or bilateral, the presence or absence of infection, and the time and location of urinary fistula, and often present as urinary fistulas formed by urine connecting to the trauma of abdominal wall or vaginal or intestinal wound. Anuria is the result of ligated or damaged bilateral ureters. Hematuria doesn't necessarily consistent with the severity of ureteral injury. The last manifestation is obstruction, which is normally caused by inflammation, edema, and adhesion. Except for a few cases of surgical injuries that can be identified in time, most cases of ureteral injury are not easy to detect in a timely manner and generally diagnosed after the manifestations lasting for 3 days or weeks and usually detected by intravenous urography, retrograde urography, B-mode, ultrasound, and CT. For the treatment of ureteral injury, the purposes generally lie in the restoration of urination pathway and protection of function of affected side kidney. Before treating the injured ureter, it is necessary to treat other serious associated injuries and to consider whether there is any injury to the bladder. The function of the contralateral kidney, the side nature, severity and time of occurrence of the ureteral injury. The bleeding and injured mucosa due to retrograde ureter intubation is often not treated spatially. As for the clamp injury or small perforation, it is required to place double J tube to renal pelvis via ureter incision and to bladder, and keep it for 7 to 10 days so as to remove drainage tube by cystoscopy. If the ureter is mistakenly ligated, it is necessary to immediately loosen the ligated side. If part or most of that ureter are defective, then ureteroplasty is required. For the long-term complication, especially patients suffering from ureter injuries for a very long time, temporary renal fistulation is required. For patients with ureterostenosis, balloon dilatation is required, and for patients with urinary fistula, the purpose of treatment is to remove the fistula and restore the normal pathway of ureter.